I was the former regional director of the U.S. Department of Health and Human Services. I'm deeply concerned about slashing Medicaid funding while also closing HHS's regional offices and the effect that this would have on devastating health care access for millions of vulnerable Americans. These aren't abstract policy changes. They represent a fundamental dismantling of our healthcare infrastructure and safety net. The HHS regional offices, for example, have long served as critical bridges between federal policy and local implementation. Our Chicago office coordinated healthcare responses across 6 states, ensuring that federal resources reach the communities most in need. We provided technical assistance to state health departments, supported tribal nations, and helped local healthcare providers navigate complex federal requirements. During the public health emergencies, from the opioid crisis to the COVID-19 public health emergency, these regional offices were command centers for coordinated response efforts. We didn't direct operations from Washington. We were on the ground in communities like this one, working hand in hand with local leaders. Eliminating these offices doesn't create efficiency, it creates distance. It severs the vital connection between policymakers and the people those policies are meant to serve. But this is only part of the threat we face. The proposed Medicaid cuts would devastate healthcare access for our most vulnerable neighbors. Here at Roseland Hospital, which proudly serves a community where many rely on Medicaid, these cuts would be catastrophic. Let me be clear about what these cuts actually mean. Children losing access to preventative care. Seniors facing impossible choices between medicine and meals. Pregnant women going without prenatal care. People with disabilities losing essential support services. Roseland Hospital, like so many safety net providers across America, cannot absorb these cuts. When hospitals like Roseland suffer, entire communities suffer with them. What makes these decisions particularly troubling is their disproportionate impact on Black and brown communities, on rural America, and on anyone living in poverty. These cuts don't distribute sacrifice equally. They concentrate it among those already facing the greatest barriers to care. I was proud to have spent my career at HHS working to expand health care and not access and not restrict it, and I've seen firsthand how investments in community health pay dividends far beyond dollars saved. Healthy communities are productive communities. They're vibrant, resilient communities where people can pursue their dreams. So today I'm proud to stand with Senator Durbin, Congresswoman Kelly, Congressman Jackson, and all of you to reject these harmful proposals. I'm urging healthcare providers, community organizations, and concerned citizens, make your voices heard. And let's remind everyone that healthcare isn't a partisan decision, it's a human right. Yes.